Namaste, good evening. I am indeed very pleased that you have all taken time to meet Apollo's team as to how we could work together to change today's challenges in health, especially in the developing and the underdeveloped world. In the early 80s, when I started a hospital, since I lost a young man who couldn't afford to raise $50,000 to go to US for a coronary bypass surgery. But the health scenario today, as you know, is different. That day's burden is to have hospitals with capabilities to handle major health problems. But today, the biggest problem that India and other developing countries, underdeveloped countries and developing countries have is this concept of NCDs, and the most important of them all is cancer.
Apollo Hospitals Group was launched in 1983. After a decade of successful running, our chairman decided that we needed to have a hospital dedicated to cancer. That which started as a 45-bedded hospital, today holds 9 hospitals across the country. We have a team of excellent doctors, efficient nurses, supported by paramedical staff, who together strive for speedy recovery of patients, extending tender loving care.
In 2008, Apollo Hospitals decided that we needed to look at a clinical dashboard, something very novel, something that hadn't been done before. So we reviewed medical literature extensively and identified the world's best published outcomes as benchmarks for the parameters that we believed were mission critical for our organization. So we have 50 of these parameters that we measure, and these parameters are part of our ACE, which is Apollo Clinical Excellence, our clinical dashboard. ACE has been very well recognized and several awards have come our way. It's actually been written as case studies, and ACE, we believe, has helped us focus on what really matters to patients, to clinicians and to the management, and that's outcomes.
A patient coming into Apollo Cancer Hospital is assured of comprehensive cancer care. Every patient is seen by the Apollo Cancer team. This team consists of the surgical oncologist, the medical oncologist and the radiation oncologist. This team together decide on the treatment modality for the patient.
And we have a tumor board of specialists of every type of cancer that get together, and especially with challenging cases, they have a discussion about what is being presented as clinical indicators and what might be the best way to approach and treat the disease, and also provide an experience that actually is better than what you might get anywhere just about in the globe.
Other than treating the cancer, we do want to pick up disease at the very early stage, and we are investing a lot of time doing cancer screenings, which has been a success of late.
A very unique thing about this hospital is we have something called as the organ-based oncology practice. For example, breast and gynec oncology, colorectal oncology, head and neck oncology, so that the up-to-date treatment on that particular site can be given to the patient.
when you look at embracing technology, I think Apollo Group is at the forefront of that aspect. In fact, Apollo has invested in 4 of the latest Da Vinci surgical robots. In the last 2 years, we've done more than 2,500 robotic surgeries. I think this has made a major impact in offering minimally invasive alternatives to patients who need surgery.
The entire research in radiation oncology revolves around how best that we can reduce dose to the normal structures apart from getting maximum dose to the target. The proton beam therapy is the answer. So the proton beam therapy is a big thing which is going to happen, and it's going to change the landscape of cancer treatment in this part of the world. Proton beam therapy delivers radiation to the target and nothing beyond.
And the umbrella that sort of covers all of this is our service philosophy. And that makes me smile because it is tender love and care. In a sense, we don't treat our patients as patients, we think of them as families. We have standards in place for each and every interaction that happens, from the point the patient presents at an Apollo entity to the point where he or she would leave the entity, all to ensure that the patient feels that Apollo is there for him or her.
Bed to bench and from bench back to the bed is an important idea. It is just the translation and interpretation of patient voices and samples from the bed to the bench, which is the laboratory. We have ethically collected more than 150,000 samples from 38,000 patients in our biobanks. We have also carefully archived more than 550,000 tissue blocks over 20 years across 6 main Apollo centers across India. But the USP of Apollo is the variety and the volume of patient samples that we have. Now this is a goldmine of information which has the potential to act as a knowledge guiding tool in our endeavor for promotion of health and prevention of diseases.
Science is meant to be open. Medicine is meant to be shared. There's so much that can be learned together.
Now, the fight against cancer is key. It is bigger, larger, greater than perhaps what we as individuals and organizations can individually accomplish. And I think that is important for us to recognize and look outside to see how we can partner with like-minded organizations, groups of individuals to try and win this fight.
We say yesterday's cardiology is today's oncology. It is not the question of cost of treating a cancer patient. The question today is, can we afford to lose people young? With all the knowledge that's available, can we not take it everywhere? I believe this can be done by each one of us trying to bring the entire knowledge that's available for the benefit of people. Apollo will coordinate with several other groups across the country, and perhaps once we have perfected the concept, why not for the rest of the world? And I think that's the prime purpose with which we are asking, please join us. Please join us in our effort to make cancer conquerable.